My name is Catia. I work for Mölnlycke Healthcare. I'm the surgical site infection specialist in the company for the South region. It's a very fancy title, but it basically means that we understand as a company that it is important to look at surgical site infections and its prevention from a global perspective, not just looking at individual factors. Therefore, there is a team now within Mölnlycke that focus specifically on looking at national guidelines, international guidelines, recommendations that verse on preventing surgical site infection. So today we're going to focus on one particular risk factor, which is patient temperature. And the potential drop of that temperature when patients are going to theaters. And to do so, we have this lovely product called Easy Warm that is designed to pre-warm patients and also to maintain that temperature throughout the surgical process. So preoperatively, intraoperatively, and postoperatively. But we'll go a little bit into that. Once we start with the presentation, I'll start off with a little video that very much mimics my role within the company. So it talks about that global solution as opposed to just looking at a single factor. Okay? We know that in the prevention of surgical site infections, this is a multi-headed hydra. There's a lot of factors we need to consider. Therefore, I'll start off with a little video that very much mimics my aim within the company and what we're trying to achieve, not just within the company, but also in healthcare in general. Okay?
It is estimated that 300,000 patients per year in England acquire a healthcare-associated infection. In 2014, surgical site infections were one of the most common and represented up to 16% of all healthcare-associated infections. This has now risen to 20%. At least 5% of patients undergoing a surgical procedure develop a surgical site infection. An estimated 60,000 patients per year are affected. The cost of a surgical site infection to the NHS can be significant. Each surgical site infection has been estimated to cost just over £10,000 per patient, with deep surgical site infections being estimated to cost a staggering £100,000 per patient. With the financial burden of surgical site infections costing the NHS an estimated £2.6 billion every year, coupled with the increasing threat of antibiotic resistance, infection prevention in the operating theatre is more important now than ever. There are a number of simple but important steps that can be followed as part of an infection prevention pathway, from the moment the patient is prepared for surgery until the time they are discharged to go home. When the patient arrives at hospital for pre-assessment, they may be provided with an antimicrobial whole body wash to use prior to surgery. The World Health Organization recommend that the patient should wash with soap or the antimicrobial whole body wash to remove bacteria from the skin known to cause surgical site infection. Using a chlorhexidine gluconate antimicrobial solution significantly reduces the number of bacteria on the skin compared to soap and water. It is important that the patient stays warm before surgery to lower the risk of post-operative complications. According to NICE, to reduce the risk of hypothermia, if the patient's temperature prior to the operation is below 36 degrees, active warming should start preoperatively. The patient can be provided with a patient warming blanket on the ward. The same blanket can be taken with them to the operating theatre. To maintain core temperature, if the patient's temperature is 36 degrees or above, start active warming at least 30 minutes before induction of anesthesia. The surgical team should take standard infection control precautions recommended by NHS England and NHS Improvement. For effective hand hygiene when preparing for a surgical procedure, the surgical team should scrub using an antimicrobial soap and put on personal protective equipment, including surgical gloves. Double gloving is recommended during higher risk procedures, but can help reduce the risk in any procedure. Immediately before incision, NICE recommend that the patient's skin is prepared using an antiseptic preparation. Wound irrigation and lavage can also be considered. This can help maintain the best possible conditions for surgery. Theatre efficiency is also important, enabling shorter procedures, reducing the risk of a surgical site infection. At the end of the procedure, NICE recommend that the surgical incision is covered with an interactive dressing. It is important that the dressing supports the wound healing process when left in place for the period indicated and through a continuous assessment process post-operatively. Once the surgical team is happy, depending on the operation, the patient could go home in as little as 24 hours with reduced risk of infection. Good infection prevention practices that are in line with national guidelines include whole body washing, effective hand hygiene, pre-operative warming, and the use of an advanced post-operative dressing. All of these help to reduce the risk of surgical site infection and support healthy patients and an efficient and effective NHS.
All right, that's our little video. Any questions from the video? Seems like good information coming out of it, all very well substantiated by our national guidelines, and that includes the NICE guidelines for surgical site infection, and also some of the results we get from the Get It Right First Time initiative or program. As you all know, there has been a report released last year following the audit across a number of trusts, a considerable number of trusts. And one of the things that came out of that report was the importance of having a multidisciplinary and also a very broad approach to prevention of infection. But as I said previously, today we're going to focus a little bit more on prevention of intraoperative inadvertent hypothermia, or inadvertent perioperative hypothermia. It has significant impact not only on clinical outcomes, but also it comes with associated costs. Like it said in the video, the estimated cost of a surgical site infection, if we're considering deep incisional and organ space SSI, can go up to £100,000. Therefore, considering the current state of our NHS, we want to make sure we save them some money as well. But clinical outcomes is definitely our main focus. We want to make sure that we have a safe environment, and that's the entire purpose of today and what we're trying to look at. So if we consider normothermia, we're talking about a core body temperature of 37 degrees plus minus half a degree, and we consider, as said in the video, that a core temperature below 36 degrees is considered a patient hypothermic. So our in-turn core body temperature regulation has many ways in which we can identify if the patient is either too hot or too cold. If there is an increased temperature, obviously we have vasodilation and sweating. And at a lower temperature, we have vasoconstriction and shivering. So good markers for core temperature indication. Anesthesia, as you all know, I'm sure, impairs thermoregulation by lowering the threshold in which the body's warming mechanisms work, and that can lead to inadvertent perioperative hypothermia. So within the first hour of anesthesia, if you have a patient that is unwarmed, it is estimated that the patient's core temperature can drop between a degree and a degree and a half. 81% of this drop is related to redistribution hypothermia. So you can see in this graphic how quickly the drop occurs, and also how easy it is for that drop to be maintained if we don't address it. Other factors that can reduce core body temperature are obviously the reduction in metabolic heat production, large open wounds, and cold environments. If you look at those three factors, you can easily link it to any surgical patient. We are definitely putting a patient in a cold environment to make sure that we reduce the risk of surgical site infections to some extent. We are making an incision to the patient's skin, and we're also reducing the production of heat, as we've seen before, through anesthetic drugs. So it is very bad to be hypothermic. You have greater blood loss and transfusion requirements, an increased risk, obviously, of surgical site infection. It can't lead to morbid cardiac events. You have prolonged recovery times. It has been shown that patients who are cold take a little bit longer to wake up even from their anesthetic. And as I've mentioned before, it does present increased costs, basically related to all the other ones. If we don't have pre-warming, and this is a little bit reinforcing the issue, peripheral temperature is obviously lower. We want to make sure that our core is warm because that's where our vital organs are. Therefore, heat distribution is as it's presented. After induction of anesthesia, obviously we want to make sure that the entirety of the body is as warm as possible. Therefore, there is the heat redistribution. If we pre-warm the patients, and this is the benefit of having that extra step when it comes to preventing infection, you are actually, by maintaining the core temperature, reducing the effect of the heat distribution. Therefore, you will have that temperature maintained throughout. And that's where our lovely product comes about. That's the whole point of having Easy Warm, as it helps to prevent hypothermia by making sure that the core temperature is maintained. So as you can see, we make sure that we account for the drop in temperature prior to an anesthetic drug being administered, and that drop is not between 1 degree and 1.5 degrees, but just 0.6 degrees, which is a considerable difference. So it is an active self-warming blanket. As the name states, it's very easy and quick to set up. All you have to do, and I'll demonstrate, is it comes packed like this, so it's vacuum packed. All you have to do to activate it is you open the packet, take it out of the packet, and open the blanket. As soon as the blanket comes in contact with the oxygen in the room, each one of the 12 pads, which I'll go into a little bit more detail on, will start to react with the oxygen in the room, immediately starting an exothermic reaction. So it's very similar in terms of the warming to the pads that you crack to, the hand warmers, but you don't have to crack these. So basically, just react with the oxygen. Takes roughly 20 to 30 minutes to warm up. And all you have to do is place it on top of your patient, and the patient is warmed. Temperature is maintained. We recommend that you do place the blanket on top of the patient prior to going to theaters. So allow enough time to so that the blanket warms up to an optimal temperature, which I'll go into a little bit more detail in a bit. You can open the blanket as soon as the patient comes in and is admitted. Patients can be wrapped around it if you prefer that patients, if it's part of your pathway, that patients walk to theaters. So you can use it as a comfort blanket even. So all you have to do is just making sure that the pads are on the outside. The patient can walk into theaters like this. Still warm, still comfortable. And that way you're preventing that drop. So going a little bit more into detail of how the blanket works. It has, as I said, pads. It's composed of pads, 12 to be more exact. They're self-activating. They start to warm up as soon as they get exposed to air. It's a natural warming material. Each one of the pads is made of active coals, clay, salt water, and iron powder. All of these materials, in conjunction with the oxygen in the room, they start to react in a process very similar to the process of rusting, which releases heat. It's only potentiated in this case. Normally, when you see the process of rusting, it takes a little bit longer, so you don't notice that heat as much. So we've accelerated the process. It has several layers of polypropylene, which are sewn together. It's a material that's very similar to our surgical drapes within the barrier range, which some of you might be familiar with. And the warming pads are placed in permeable bags. So if you want to take one off, you can. And this is what they look like. Come in little pockets, which is very handy. As you've seen, they come in a vacuum-packed bag, and it can be disposed, and this is an important one, they can be disposed in normal waste if they're not contaminated. So when it comes to disposing of the blanket, even in optimal temperature, there isn't a fire hazard. All you get, even in optimal temperature, is condensation in a bag. If it is contaminated, meaning if there is any bodily fluids that have come in contact with it, all you have to do is dispose in your yellow bins, in your contaminated waste. Yeah. So these are the two sizes we have, which are now open, so feel free to have a look. We have our standard size, and we have our Easy Warm Plus. Differences between them, it's mainly this, the Plus is slightly bigger, and it has a Velcro strip, so it's easier to position on patients, especially if you're doing large abdominal surgery. You can split it, and you still have core protected, and the legs as well, extremities. Going back to what I was saying in terms of the timing it's maintained throughout, so it reaches a temperature of 42 degrees, and it maintains that temperature on average minimum of 10 hours. It says up to, but it's actually minimum. The reason why we talk about the 10 hours is because it's the minimum amount of time we noticed that the pads were warmed up during testing. So that's our minimum value. From experience, I can tell you that it's more between 16 and 20 hours that it lasts for. So even if you have a long procedure, you can make sure that your patient is warm throughout. As I've mentioned before, it reaches operational temperature in approximately 20 to 30 minutes. We've just opened these, so they're starting to warm up. You'll get a chance to see them fully warmed in relatively no time. So, and that's pretty much it for me. So if you have any questions that you would like to ask, feel free. That's what I'm here for, whether it is about Easy Warm or something else. And feel free to have a play with our blankets. Have a look at them. Should you have any questions, either here or upstairs, feel free. Yes?
Hi, which trusts are these
All right, that's a very good question. So we have a number of trusts across the country using them. I would mention one in particular. If you're familiar with the SSI report for the Gerfton program, you have a case study in it for Ashford and St. Peter's. They use our blankets. Their internal protocol at the moment is for every patient that is going to have surgery that's going to last more than an hour is receiving one of these in the ward. One thing that we can be proud of as a company in our product, obviously, is the fact that by introducing the blanket as one of their solutions in a multidisciplinary approach, they've noticed a reduction in hypothermia from 44% to 3% in their neck of femur patients, fractured neck of femur patients. That is a considerable drop, which we're very, very proud of. And we continue to work in collaboration with them. As I said, there are a number of trusts who are using it across the country. From memory, I think up north, Newcastle is one of them. But I can...
So it's relatively still quite new, so not many trusts?
We have considerable usage across the country, yes. I can give you a list of places where you can have that communication with, if you like.
Sorry, is there any risk of like static electricity generated with these blankets?
Not that we're aware of. We've never had any reported adverse events to that regard. The only thing I would say in terms of precautions, and there are a couple, that we like to emphasize. So in terms of using them in patients with reduced sensitivity, just make sure you monitor them a lot more closely. Obviously, you have warming pads in contact with the patient, so monitoring is essential. It's still a medical device, it needs to be monitored. The other thing would be not placing anything heavy on top of the pads, as you wouldn't with anything warm. Just pressure, prolonged pressure, can cause issues. Not that we've had adverse events of notice reported that would link to effective usage of the blanket. The other thing would be make sure they are safe to be used with x-rays. The only thing would be the pads are radio opaque, just making sure that you position the blanket outside the x-rayable area. No MRI. It has iron powder in it, unless you want it to stick to the MRI machine, which is not a good look. You'll get very, very upset imaging teams coming back to you. I wouldn't recommend it, but if you consider how long the patient is going to be on an MRI machine, you remove it and you can place it back. We recommend that you place the blanket not directly in contact with the patient's skin, which it wouldn't be anyway. So you would either have the patient's gown on, if the patient is in the ward, or if the patient is in theater, have a sheet in it as well. It's safe to use in conjunction with drapes in theaters. You can stick drapes to it, and it wouldn't damage it at all. But for more information, feel free. We have some additional information upstairs, and we can have a little bit of a discussion about it. Yeah. Yes.
So they're all single use?
They are single use.
Right.
Yes.
So I suppose there's the cost associated with that, but also it's about, it's just interesting really as a company, what are your plans really around investment really in recyclable materials, bearing in mind the impact or the responsibility now that trusts have around kind of trying to achieve carbon neutrality. So this is an additional
Absolutely.
thing that will contribute to their waste.
We are continuing to work within our research and development units, and we're striving more and more to be eco-friendly. I would say from the perspective of this particular material, considering that it is single patient use and the location in which the patients are being in contact with it, there's a higher potential of contamination. Therefore, we know that if we re-sterilize equipment, there is a significant impact in terms of water contamination because of all the chemicals that are being used. Therefore, it's sort of a balance between, yes, we want to make sure that we are environmentally friendly, always, of course, and the packaging is recyclable because it's plastic, so you can't recycle that. In terms of the blanket, I would say from an infection prevention point of view, an infection control point of view, considering it a contaminated material, you would want to get rid of it. And make sure that there isn't a risk of potential reuse and cross-contamination. But yes, definitely, we're looking at many angles in which we can improve our efficiency and still be eco-friendly.
And what sort of comparison studies has there been about using this around 2 blankets for a patient? Something that might be a resource that I appreciate. Discussing about a pillow area.
Yeah.
Maybe.
In terms of versus 2 normal blankets, I don't think we have any. We tend to do comparative studies around active warming systems as opposed to, or this versus nothing. In terms of maintaining temperature, because you're not using, if you use a normal blanket, it's passive warming. So there isn't an active increase of temperature, or there isn't a barrier to let that temperature evade, so to speak. It's a little bit apples and oranges in terms of the efficacy of the solution that you're using. But I can forward all of the research materials we have so that you can have a look. See if there's anything that there's a little bit more interest. Yeah? Anyone else?
How much are they?
So it's very much depending on your route distribution route.
I would say when it comes to the pricing, just come and see us, because obviously each hospital buy different routes, distributor routes. So if you want to find out more about the pricing, just pop upstairs and we can have this conversation.
Yeah. And we can get in touch with you and discuss your Chelsea Westminster in particular. But yes, we can have that larger discussion. And we have a rebate system as well, so we can look at that. So feel free to have a look at them a little bit closer. You can circulate them.